Hey everyone, Kevin Jefferson here, the DC Foot Doctor, with another live stream Q&A. Thank you all for joining me. Let me know if you can hear me. Just give me some shout outs. See, Joy from Florida, Janine's in from the UK. Good to see you again, Janine. Can everybody hear me okay? Siapa Sita from Brazil, thank you for chiming in. I see Cameron can hear me. Jackie, thank you for joining. Jonathan from Southern Maryland, you got to come up to DC, man. Come check us out. All right, Carissa, hi, and Barbara. Hey, Nicole. Hey, when you guys chime in, let me know where you're from so we can see how wide a swath we got here today. All right, Wendy Sanchez. All right, Ron from Maryland. You got to come see me, brother. You're right down the street, Killeen, Texas, Fort Hood. All right, Darlene. All right, Linda. Chicago, Wendy. Florida back in. Oklahoma. All right, more Florida, Augusta, Georgia. Scotland, Italy, Houston, San Jose, NC. More UK, Oregon, Memphis, man, Philly. Where you from, Terry Rogers? Ohio, Arizona, Georgia. Hey, Georgia, I'll be down there this summer for our annual convention. Looking for you down there. Minneapolis. Terry from Big D. Hey, I'm a Bishop Dunn graduate, Dallas, Texas. Oak Cliff. Terry, we got to hook up. Paramount, California. All right. See, we got the people coming in. Good to see everybody. Again, I'm Kevin Jefferson, DC Foot Doctor. We're going to be talking primarily about diabetes and its effects on the foot. Be more up the street. Good to see you. So today's focus will be primarily on diabetes. When I take questions, I will be focusing on those questions first, and then we'll go from there. I just open up with a little spiel about diabetes in the feet. Now, if you didn't know already, at least in the United States and in much of the developed world, diabetes is the leading cause of amputation of the foot and leg. There are a number of reasons for that, but diabetes is running rampant, particularly in this country. The number of diabetes cases are actually going up. They're not going down. Okay, so we need to be sure that we are recognizing diabetes earlier in folks, and we will help to do things to help deal with this scourge. Debbie, a nurse, right? I need your input. Help me out here, lady. Later here, Debbie J. So when it comes to diabetes, it is the number one part of my practice here in Washington D.C. In the United States. Washington D.C. still being highly African American in its population. Diabetes is a very big problem, just like other parts of the country, particularly the deep South. If DC were actually a state, it would be the number one or number two state for prevalence of diabetes. So we're going to be talking about a lot of things here. Gwendolyn, thank you for chiming in. Got that for me, Zay. Different channel. I think it might be a different channel. Okay, well, we're going to keep on going here, man. Um, so, number one issue that diabetes causes when it comes to foot problems is with circulation. Now, diabetes, you have to remember, is a total system, total body disease, head to toe, skin to bone. But primarily in the circulation, particularly circulation to the feet in this instance, it causes a greater acceleration of plaque buildup in the arteries, particularly the major arteries of the leg and feet. So this causes a decrease in circulation, making the foot more prevalent to developing gangrene and infection, and leading to amputation, even with minor injuries, a little blister, a little cut, that can also go on to a full-blown ulcer, that can lead to a serious infection, gangrene of the part, and subsequent possible surgery and amputation. That is the major problem in this country: diabetes and circulation. We're going to be talking about prevention of things uh, of that nature as we move forward in this discussion. But if you are Heinz, but the number one thing I would tell all my diabetics out there, if you have no idea of what your vascular status is to your legs and feet, I suggest you find that out right away. Just going to a doctor's office and having that doctor put his or her hands on your feet and feel your pulses is not enough. You got to have some vascular testing, get what we call an ABI, an ankle brachial index, to determine what, if any, level of circulatory loss you have in your feet or to your feet, so you can get those situations addressed and reversed. Okay. Another issue that we see in our diabetic patients when it comes to circulation is a good number of them, believe it or not, smoke. Smoking and diabetes is a terrible combination. Smoking in anyone right off the bat causes a decrease in circulation. It causes constriction of the blood vessels and therefore a decrease in blood flow. So if you already have diabetes and you already have uh, issues with your circulation, smoking is just going to compound that. So if you do have diabetes and you smoke, I suggest you immediately get into a smoking cessation program, whether it be medications, whether it be therapy, or what have you. Talk to your primary physician about that and get into a program where you will be able to decrease your smoking to the point where you are no longer smoking, because smoking and diabetes is a dangerous combination. It always ends up very badly. Another issue that we face with diabetes is peripheral neuropathy. Now, what neuropathy is any injury, damage, or uh, malfunction of the nervous system. And diabetes, we see that it causes numbness, tingling, funny sensations. Patients may complain of burning, itching, things of that nature. So when we see peripheral neuropathy in patients, typically what can happen is over time, the symptoms will start in the toes or in the fingers and slowly over time move their way up the foot and up the leg. What happens is the person may lose sensation, what we call protective sensation. So they may not feel heat, they may not feel pain, they may not feel a little scratch. So let's say they're walking down the street, they're wearing flip flops, something gets between their shoe and their foot, a little piece of rock, a little piece of glass, or something like that, breaks the skin, cuts the skin. The patient has peripheral neuropathy, can't feel it, and so they have no idea that they have an injury. 3, 4 days, 5 days later, they have this whopping infection, and now they're in the doctor's office or in the emergency room trying to get this situation rectified. And often the issue has already gone too far, and we end up having to do surgery on the patient. Now, let's talk a little bit about ways you do yourself, some things that you can do to prevent issues if you have diabetes, and two, if you have diabetes and any of these issues. Number one, before anything else, is to control your blood sugar. If your blood sugar is not controlled, if that hemoglobin A1C is not below 6 and kept below 6, if your numbers, your daily numbers, aren't being taken and checked, and your blood sugar is spiraling out of control, nothing else will help. You can take all the other precautions you want to, but you're heading downhill if you're not taking care of that blood sugar. Number two, what you need to do is be sure that you're seeing a podiatrist on a regular basis. Your podiatrist will examine your feet, skin to bone, look for areas of deformity, skin changes, uh, circulatory issues, check your nervous system on a regular basis to see if there's any continuing of any problems, any worsening of any issues, and that doctor will be able to take action to rectify those issues and to prevent further issues. Number three, be your own advocate for your feet. Check your feet every day. Okay, check your feet daily. Make sure that there's no breaks in the skin. Make sure that there's no redness around the nails. Make sure there's no swelling. If you're having issues such as cold feet, if you're having numbness, tingling, situations like that, don't wait for them to go away on their own. See your podiatrist, call your primary physician, get a referral to make sure that these things are addressed so they don't become major problems down the line. Check your shoes before you put them on. Pick your shoes up, hold them upside down, shake them out, run your hands through the inside of the shoe, make sure there's nothing in there that shouldn't be there. I see all the time patients will come in with a thumbtack or something in the bottom of the shoe, sticking through the sole of the shoe, or a nail, something like that, and they had no idea because of neuropathy. They come to the office complaining that their foot is bleeding. They have no idea why. I look inside the shoe and I pull out a 2-inch nail that they didn't know that was in there. True story, I've seen that dozens of times, and every podiatrist can tell you the same story. So be sure that you're checking your shoes regularly. Wear socks, wear stockings. These socks and stockings will cut down on friction, absorb moisture, prevent skin issues that can lead to skin breakdown. If you having issues with your toenails or corns and calluses, do not try to deal with them on your own. Get a referral or see a podiatrist and let that doctor take care of those issues for you. I can't tell you how many times I've had patients come to my office who have tried to shave their own calluses at home with a kitchen knife or something else like that, injure themselves. Maybe they knew they injured themselves because of bleeding right away, or maybe they didn't know they had injured themselves because of neuropathy. Show up to the office, a big swollen purple toe, and have no idea. I ask them if they've been rendering their own foot care. They'll say yes, and I'll tell them that what you've done is you've injured yourself and you didn't know it because of the neuropathy. Maybe you have poor circulation on top of that, and now we're in a situation where you're at risk for loss of the toe because you tried to trim your own toenails. So all these things can be avoided with proper professional foot care. All right. People always ask me about diabetes, the feet, and dry skin. Remember, we talked about peripheral neuropathy. Moisture of the feet comes from natural amount of sweat. Sweat is controlled by the nervous system. So if you have neuropathy, the autonomic nervous system that controls sweating may not be working. So that will cause dryness of the skin. Chronic dryness of the skin can lead to uh, the skin being thin, or just the opposite. You can develop calluses, cracks in the skin. These cracks can open and allow bacteria in, and now we're in the same situation as before. So moisturize your feet on a regular basis, daily basis. Use a good cream, lotion, shea butter, something of that nature. Apply it to your feet daily. Do not put it between the toes. The only thing that goes between the toes are sprays, powders, or gels because they go on dry. But moisturize your feet every day, socks, stockings, well-fitting shoes. Diabetics should wear shoes that completely cover the feet. They should not wear sandals. They should not wear flip-flops and things of that nature because they may be exposed to things in the environment as they're walking around, and that includes in the home. You don't have to wear your dress shoes or your sneakers around the house, but get you some house shoes that completely cover your feet, and don't walk around the house barefooted. All right, now let's take some questions here. See what we got first. Okay. Wow, we got quite a few people chimed in. We got 90 people chimed in. All right, now, Isaiah, hit me with some questions. You see anything there on your screen?
I'm trying to
Jazzy 53, this is what I need you to do. I'm going to start with diabetes, but I will answer your question concerning plantar fasciitis if you leave that question in the comments section. John Kelly, is there any way to improve circulation at home? You don't smoke. Number one thing to do to improve circulation at home, one, if you do smoke, quit. But if you don't, there's some other things that you can do. One, stay active, exercise, walk, go to the gym, things of that nature. You don't have to spend a whole lot of money or do a whole lot of effort. The pumping mechanism of the muscles as you walk, I mean, active walking, uh, focused walking, whether it be for 30 minutes, whether it be for a mile, whatever works for you, treadmill, exercise bike, things of that nature, keeping those muscles active, keeping them working, keeping them pumping to move that blood through the legs down to the toes and then back up to the heart. That's the number one thing I can tell you to improve circulation. Number two, if you have some issues concerning your circulation, get it checked out. See a podiatrist who does vascular testing in his or her office. Just putting fingers on your feet is not enough. You got to get your circulatory issue quantified so we can see what's going on. All right. Next question. Go ahead, Jay.
Um, Miss Tanya Benfield,
Mm-hmm.
is it tobacco or marijuana that causes the issues in diabetes when smoking?
Any type of smoking, remember, whether it be cigarette, cigar, pipe, marijuana, any type of smoking causes vasoconstriction, causes the blood vessels that are here to contract and close, even for a short period of time. So if you have poor circulation, you have diabetes, and if this is an issue, and if you're taking marijuana either medically or recreationally, you need to talk to your doctor about that to see if there's another way to deal with the issues of why you may be taking medical marijuana, because we don't want the issue that you're taking the medical marijuana to cause problems with the circulation in your legs and feet because of the smoking effects. So definitely talk to your primary doctor, talk to your podiatrist about that, and see what other options you have to deal with the issues of why you may be taking marijuana. Next question, Isaiah.
Um, from the next question is from Jennifer Holtzaby,
Mm-hmm.
Apple. My fiance's bottom of his feet are really shiny, tight skin, and says it feels like pins and needles, and he has loss of pain. Could that be diabetes?
Well, if he hasn't been uh, diagnosed with diabetes, he should definitely get it checked out by his primary physician. What you described, the shiny skin, the numbness, sometimes pain, and or loss of pain on the feet, particularly the bottom of the feet, uh, are all descriptions of neuropathy. The idea or what needs to happen is to find out why he has the neuropathy to begin with. Diabetes is not the only cause of neuropathy, particularly here in the States, but it is the number one cause of neuropathy in the United States. But other issues can cause this, similar symptoms, such as back problems, problems with disc in the lower back, previous injuries or arthritis of the lower back, or anything along the nerve chain between the lower back and the foot. People with sciatica will also complain of symptoms that are similar to the peripheral neuropathy that we see in diabetes. So, like any situation, what you need to do is find out what's causing it so it can be dealt with. If he has no problems with his back or anything else like that, he should definitely be screened for diabetes. What's the next question, Zay?
A Miss Lucille Griffin asks, my problem is my tendons and my toes are contracting. I wear very soft, cushiony shoes and slippers, but my toes feel like they're curling.
Mhm.
What can I do?
Uh, if you have diabetes, you didn't say that if you did, but if you do, uh, increasingly curling toes are also a sign of peripheral neuropathy. As the innervation or the nerve function of the toes begins to decrease, we start to see contraction of the toes as you get muscle imbalance uh, in the feet. And so we see the contraction of toes, or what we call hammer toes. It may be an isolated toe, or it may be up to all 10 toes. But if this is an increasing situation and it's causing issues, especially wearing shoes, it could lead to the formation of corns. It could lead to the formation of skin breakdown and ulcer formation. So again, like anything else, see your doctor about it. See your primary, see a podiatrist, and get your nervous system and your circulation checked out to see if there's anything else that could be contributing to the formation of the curling up of your toes. My nephew Isaiah is moderating for me today. Uh, what's the next question, Zay?
The next question is from Elizabeth Willow.
Hmm.
Could you reverse neuropathy?
Neuropathy, because it's nerve damage. If the damage is already done, neuropathy will not cure or cause a reversal. No medication will cause a reversal of the neuropathy, but the symptoms, at least at this point, can be managed and controlled. Once you have neuropathy, particularly if it's caused by diabetes, uh, you'll always have neuropathy, but it can be treated. If it's pain, there's pain ways of dealing with pain, pain management to deal with the pain of neuropathy, whether it be pain medications, whether it be vitamin therapy, whether it be biofeedback, a number of ways to deal with it. But neuropathy, at least as we know it now, is not reversible, but it is treatable. Next question, Jay.
The next question comes from the next question comes from a Miss Melissa Nicholas.
Mm-hmm.
Laser treatment for fungal nails has been proven to be ineffective.
Mm-hmm.
What other treatments do you suggest to get rid of fungus?
Well, there are a number of ways to deal with fungus, whether it be medications, whether it be topical medications, oral medications. This is an issue that we see a lot in our diabetic patients. Diabetic patients, especially at advanced diabetes that's uncontrolled, tend to have a lower immune system. So if you have a lower immune system due to any cause, you're going to be more prone to develop infections, whether it be the common cold, a skin infection, or fungal infections of the nails and our feet, and or feet rather. So laser treatment, I don't use it because of the very thing that you stated. The findings are not that great. Otherwise, every doctor in the country, every podiatrist in the country would use it. So I haven't found a need right now to use go into the cost of getting a whole laser system for something that I'm not quite sure is going to be very effective for my patients. But there are medications, topical, oral, combination of the two. Uh, other things as well as treating the shoes, keeping the shoes nice and disinfected to keep yourself from reinfecting yourself. That can be used to deal with toenail fungus. What we got? What else we got, Jay?
The next question is what are your thoughts on using a platform vibration machine, quotation body shaker, to increase blood circulation?
Blood circulation works best or is improved best by exercise. Now, the platform, the vibrating machine, I know what you're talking about. I've seen those. Are the kind that you where you're sitting in the chair and it vibrates the foot, is this, or this the kind where you're standing. If it's giving you good muscle contraction, not just shaking your leg, it may be beneficial. I wouldn't go out there and spend a lot of money on something where a good brisk walk down the street for 15 to 30 minutes would do just as well, if not better. Okay, I think I have it up here. Okay, let's see if I can get some here. Okay, Lori Jones asked about restless leg syndrome. Now, restless leg syndrome, because it's a nerve issue, is also falls within the family of neuropathy. But again, what is causing it? Is it lower back? Is it a vitamin deficiency? Is it diabetes? Is it an injury somewhere else in the leg? Is it psychosomatic? Who knows? But the thing with restless leg syndrome, like any other neuropathic situation, there are multiple causes of it. So the cause of finding out what is causing it, finding out the cause of it, is paramount to helping you with that situation. Let's see what else. There's the platform. Is cramping? Regina Brown asks, is cramping in the feet a sign of diabetic neuropathy? Thank you much, Regina. It very much is a sign of neuropathy, but cramping is also a sign of poor circulation. It's just like when a jogger or other athlete is having cramping in the muscles of the legs or the arm. That's due often because of either a buildup of lactic acid, or it can be from a decrease in blood flow to the part. So a decrease in blood flow to the feet can also cause cramping of the foot, uh, the toes locking up and things like that. So it can be a sign of diabetic neuropathy. So if you or the person you're concerned about has diabetes and they're getting cramping, especially if they're getting cramping often in the feet, if their circulatory system to their feet and their nerves have not been evaluated thoroughly, that's something that needs to be done as soon as possible. Let's see. All right, the traveling pedicurist, an advocate for diabetics, getting routine massage for the feet and body to help with circulation. How do you feel about massage for diabetics? Massage is excellent. Again, anything that's going to work the muscle groups. And a good massage therapist will know which direction to work his or her hands and other tools to cause the muscles to work, cause the blood circulation to move in the direction it needs to, whether it's arterial blood that needs to go to the toes, whether it's venous blood that needs to go back up to the heart. Massage is excellent. If you can self massage and if you know how to do it, look up the techniques and how to massage your legs specifically for circulation, then that's great. A massage therapist is fantastic. We see massage used by our physical therapists when they're dealing with our diabetic patients. So massage is an excellent technique to help improve circulation. Cool News USA Lafayette. Cool name. I like that name. What's a good lotion to use for feet with feet pain? Again, if we're talking about uh, neuropathy, and if you have dry feet as a result of the neuropathy, you want something, a lotion that's going to be help to, one, moisturize the feet, two, help break down that dry, flaking skin so that the lotion that's causing the increase in moisturization can penetrate. What I prescribe often for my patients is 12% ammonium lactate. Very good. It's available for prescription. So folks who have healthcare can get a prescription for it to defray their costs. For those who don't have health insurance, it's not terribly expensive. So you can get it from behind the counter, even with a prescription. And it does very well when used daily by my diabetic patients to help moisturize their feet, break down the hardened and dry skin, and improve the turgor of the skin. Thanks for the question. Linda Kane. I have thyroid problems and diabetes, and my feet stay very dry, and I've tried everything, even shea butter. Nothing helps. What do you suggest? So, Linda, the double whammy of thyroid disease and diabetes. Tough situation when it comes to skincare. Diabetes by itself, as I described earlier, can cause dry skin because of peripheral neuropathy. Thyroid issues can also cause dry skin, particularly hyperthyroid. So what you will have to do in your case is do things in combination. Why people fail with skincare and products is because they'll use one, it doesn't work for a while, and they try something else. If that doesn't work, then they'll try 4, 5, 17 different things, and nothing is working. So what you should do, Linda, is to use things in combination. And so you should use a moisturizer. And in your case, you need a cream, not just a lotion, but a cream. A cream is going to be a little thicker, so it's going to stay on your feet. A little harder to work into the skin, so you don't want to use too much, so it's not sitting on top of the skin. But a little bit, and use it in small areas. You take a little bit of cream in one area of the foot, work it all the way in, then you get some more, and you just work your entire foot, top and bottom. And then what you can do to help is use something that's oil based, petroleum based, petroleum jelly, baby oil, something like that, on top of the cream that you have applied to help maintain the cream where it is, The petroleum product or the baby oil will work as a barrier to prevent the cream from being absorbed in your socks, stockings, bedding, or just evaporating. So try things in combination and see how that works. Don't give up too early. What I find is that a lot of folks will give up too early on topical products, looking for improvement in just a few days. Remember, any skin issue takes a long time to fix. So something that takes years to develop is going to take a long time to help repair. So be diligent, be patient, trial and error to using things in combination and see what works. But if you're going to use things in combination, use one water base, one oil or petroleum base, not two of the same. Darling Ridgeway, type 2 diabetes, sometimes feeling tingling in hands when they're cold and in my feet when I've been standing for long periods of time. So, Darlene, thank you for your question. With your type 2 diabetes and this symptoms that you've been describing, you definitely need to get your circulation and your nerve system in your feet thoroughly checked. Make sure your circulation is wide open. If it's not, get that issue taken care of and see if there's any issues with your nerve. Now, if it's an issue with just standing, not when you're sitting or lying, then the issue could be an issue with your spine. Remember, the nerve system, when it goes out to the periphery or arms and legs, comes out of the spine first. So if there's a spine issue, if you have an issue with the spine in your neck, you can have issues with your fingers. If you have an issue with your lower back, you may have symptoms in your legs and feet. So get a complete physical, a thorough workup to see what's going on with you, particularly if your symptoms occur only or more often when you're standing. But pay closer attention to see if you notice the same things in other positions, whether you're lying, whether you're sitting, or whether you're in a vehicle or what have you. And then check to see if changing your position decreases or increases those symptoms. And if so, that's something else you also need to report to your physician to get to the bottom of what's going on. Marilyn Pearson, fantastic question. What is the best way to tell if you have a fungal skin infection on your feet versus dry feet when you have diabetes? Now, dry feet from diabetes or any other situation tends to present itself a little bit differently than a fungal infection of the skin. Fungal infections tend to occur in what we call a moccasin distribution. If you know how moccasins are worn, they come, let's say this is the foot, they come to the side of the foot and around to the bottom. They don't go over the top of the foot. Dry foot or just a dry skin issue will typically be the entire foot. But a fungal infection tends to be just the sole of the foot. But if you're still not sure, I suggest you go to a podiatrist, have some of the skin scraped off the bottom of your foot, and sent to the lab, and the lab will take a look at it and see if they see any fungus in those skin scrapings, and therefore the doctor will be able to make the appropriate recommendations for treatment. Sometimes we'll see a combination. It may be dry skin as a result of the diabetes and the fungal infection. So if that's the case, then you need to deal with things on both ends, an antifungal and a moisturizer to deal with the dry skin. Awesomeness More, solid name. Is gabapentin the best medicine to take? I'm taking the max 3,600 milligrams per day and still have severe pain, especially at night. Does gabapentin have side effects? Awesomeness, thank you for the question. Very good question. Uh, Dealing with peripheral neuropathy with oral medications can be very difficult. If you're taking the highest dose of gabapentin, you're still not getting any relief of your pain, then you need to talk to your doctor about either one, changing the medication, or two, changing how often you take it. If you're taking it 3 or 4 times a day and you're still not getting results and you're maxing out on the dosage, then that medication definitely needs to be changed to something else. If it's not working for you, it's not working for you. If your symptoms are not decreasing, or especially if they're getting worse, then something needs to change. Just because now you've been taking it for 3 weeks and you're still not getting any results, that doesn't mean necessarily mean it's going to get better in 5. When we're dealing with medication, particularly oral medications to treat peripheral neuropathy, there is some time to determine what's going to work for you. What we have to do is what we call titrate that medication. That is, we change the dosage either up or down. We change the number of times the patient will take it either up or down to find a place that works for that particular patient. Gabapentin may work great for someone else. It may not do a doggone thing for the next person. So there is some trial and error. There is some hit and miss. And I understand it's very frustrating, but that is something that you have to do and work in concert with your physician to figure out which medication and which dose and how often a day you have to take it for it to be effective. And again, doing also things in combination. Uh, Vitamin therapy, particularly the B vitamins, whether it be injections, whether it be oral, whether it be combination, may also be necessary for you to start getting some relief. Biotherapy, biofeedback, physical therapy, and some of those things may also be necessary for you. Again, thanks for the question. Let's see what else we got. Margaret Hill, my right leg hurts at night when I go to bed and wakes me up sometimes. Is this something bad? Any pain that wakes you up in the middle of the night is always bad. I don't care if it's your leg, if your belly headache, whatever it may be. That's something that definitely needs to be checked out. It more than likely is not going to go away on its own. So I definitely suggest that you start with your primary physician on that one. If you have diabetes, see if it could be related, and then go from there. More than likely, if especially if it's been occurring for a while, it's not going to fix itself. Okay, go ahead.
Miss Lauren Bahar,
Mm-hmm.
my vitamin D level uh, blood is 3.4. I
Mm-hmm.
was told not to take vitamin D because my calcium and PTH are high. Is
Mm-hmm.
this a concern? I have absolutely no feeling in my hand or wrist.
Okay. Now you sounds like you're getting conflicting advice. So you were told to take vitamin D, but because your numbers are elevated, you were told not to take vitamin D, and now you're having these symptoms in your hand. Number one, if you're having nerve symptoms in your hand, you need to get particularly the spine and your neck checked out to see if there's an alignment problem. I don't know if you have a history of an injury and accident. We see this often after car accidents. People may have been in a motor vehicle accident years ago, and now a few years later, now they're developing symptoms because of changes in their spine or the disc between the vertebrae. So definitely start there. See your physician and see what's going on with the spine, particularly your neck, upper shoulders, and see if that's related to what's going on. See what else we have. Okay. Now, if I miss your question, I apologize. Sometimes they come in fast and furious, so we're trying to keep up. If I missed it, and especially if it's related to the topic of the day, which is diabetes, please repeat that. And if by the end of this session I still don't get to it, please repeat that question in the comment section of the replay, which will go up later today.
I have a question from another question from Melissa Nicholas.
Mm-hmm.
My doctor recommended an oral medication for fungus. I've been afraid to take it because of the possible side effects on my liver.
Mm-hmm.
Have you noticed liver issues in patients taking oral medicine?
Now, I've been prescribing oral medication for toenail fungus for many years. And I can count on one hand how many times I've had to take a patient off of the medication because of liver issues. Now, what I do and what the recommendation is for anybody taking oral medication for toenail fungus is to have basic blood work performed before you start. One way to make sure that the liver is functioning properly. So these are very safe medications in the right patient. There are other medications that are processed by the liver. Your statins for cholesterol are processed by the liver. Alcohol, in our beers, wine, and everything else, is processed by the liver. So if there's underlying liver issue that's not addressed, that could be exacerbated by these medications for nail fungus. So we always test folks prior to starting that medication. Sometimes we may test the patient again halfway through or at the end to see if there's been any changes. But other than that, I have no problem prescribing these medications in the right patients with no history of liver disease, and patients who blood work comes back normal as far as the liver is concerned. Now, if anybody's blood work comes back showing some elevated liver values, then I will refer them back to their primary doctor to get that situation taken care of first before starting them on any oral medication to treat nail fungus, and in the meantime, start them on something topical while we're trying to get that situation taken care of. Thank you. Dutch Delight from the Netherlands. Thanks for chiming in. Let's see, where are we?
I have a question
Good.
from Hestia A.
Mm-hmm.
How do you support family or friends that have foot issues due to diabetes but won't take the necessary steps to minimize the possibility of amputation in the future?
Okay, so dealing with a difficult family member with diabetes and their foot care. The very common issue that we face is people not coming to terms with their condition, with their disease. Diabetes is a chronic disease, like rheumatoid arthritis, like uh, high blood pressure, and things of that nature. They're lifelong conditions. And so the hardest thing that people have to deal with whenever they're diagnosed with a chronic condition is accepting that it's a chronic condition, and two, dealing with the immediate lifestyle changes that have to take place. I have family members with diabetes, as I'm sure probably everybody on this stream has. The biggest difficulty they have is not the medication, it's not the finger sticks, it's not going to the doctor, it's the lifestyle changes that they find difficulty dealing with. Not being able to eat the fast food, not being able to drink the sodas as they used to. Not be, when you go to a family event, barbecue, Christmas dinner, Thanksgiving, what have you, and everybody's is drinking and eating what they want, and suddenly you were told a few weeks ago that you have diabetes, but now suddenly you can't eat that way. Suddenly you can't drink that way. Suddenly you can't participate like everyone else. So it's difficult for them to make that switch immediately. So what you have to do in this case with your family member is keep working with them. Don't browbeat them. Nobody, is convinced that they have an issue if you keep beating them over the head with the issue. You just keep educating them. Show them things like this video. Show them things like other videos out there dealing with diabetes and foot issues, and educate them. Bring them up to speed. Show them what can happen if they keep neglecting these issues. Uh, Go with them on their doctor visits. Sit in the room with them so you can discuss with the doctor your concerns with that family member so everybody can be on the same page. Don't give up on them. Just keep working them gently, keep providing them information, keep giving them education about what needs to be done with the diabetes in the feet. If they smoke, gently keep working with them on quitting the smoking, encouraging them to get into a smoking cessation program and what have you. Encourage them about the proper footwear, socks, shoes, and things of that nature. And eventually they will come around.
Um, the next question
Mm-hmm.
from Melissa Gunn.
Go ahead.
Hello, doctor. What are some symptoms of plantar
Plantar fasciitis.
fasciitis? Yes. And how do you treat patients for this?
Okay, here it is. I'm looking right at it. Thank you, Zay. Symptom of plantar fasciitis. It's a little bit off subject, but I'll answer it real quick for you. Thank you, Melissa. Plantar fasciitis To understand what plantar fasciitis is, you need to understand what the plantar fascia is. The plantar fascia is a tough, fibrous, somewhat elastic tissue that connects the heel. Let's say this is the heel, and the toes are here. Connects from the heel out to the ball of the foot, and it's just below the fat in the bottom of the foot. And the purpose of the plantar fascia is to supply support to the foot, some shock absorption as we walk around, and to protect the underlying structures such as the bone, uh, ligaments, tendons, blood vessels, nerves, everything else like that. But like any fibrous tissue that's connected to the bone, there can be inflammation where it's attached to the bone, whether it be in the heel, when we talk about plantar fasciitis, or in the knee, like runner's knee, or we see in the shoulder and folks who have chronic use of the shoulder, such as athletes and other people whose jobs require them to do a lot of lifting. You can see inflammation in those areas. So that's what plantar fasciitis is in a nutshell. I will be doing a live stream in the future devoted just to this issue. But if you have further questions about plantar fasciitis, Melissa, please put that in the comment section in the replay of this video, and I'll be sure to address it further for you.
The next question from a Joy Kaiser.
Mm-hmm.
Do you have patients who were in the Vietnam War and were exposed to Agent Orange with diabetes? And if so, do you see a correlation?
Okay. Agent Orange, they're still working on that issue. My father was in Vietnam. He was exposed to Agent Orange. God rest his soul. And he had some neurologic issues. He had diabetes. So, is there a direct correlation between Agent Orange and diabetes? If there is, I'm not. I wouldn't be surprised. There's nothing out there that I've read or heard of where there's been a direct correlation to those who served in theater in Vietnam and were exposed to Agent Orange or any other uh, biological, chemical warfare, for that matter. I know soldiers that were exposed to agents in Desert Storm and Desert Shield, and they're now having issues concerning their neurologic symptoms, the neurologic systems rather. So, is there a direct correlation? I couldn't rule that out, but your father, I'm hoping that he's being checked out. If he's uh, has a local physician that he's working with, or if it's in the VA, that he keep plugging along with this. Dealing with these issues going back to war can be difficult. Dealing with all the red tape can be difficult. I have a good friend of mine who's had to deal with this because of exposure he received in Kuwait in Desert Storm. So uh, keep working on this. Keep looking. Do some research. Have some facts in your hands when you go to talk to your father's doctors about the situation. But number one, keep that diabetes in check. Keep those blood sugars squared away, and you can go from there.
The next question is from Miss Audrey Abdu.
Mm-hmm.
Is my Equinus
Mm-hmm.
contracture caused by diabetes type 2?
Okay. Audrey, thank you for the question. She asks, is my equinus contracture caused by diabetes type 2? For those who don't understand what equinus from the word equine, which is horse, means that your foot is down in this position. All right? The arm is, the leg is here, and the foot goes down. That is caused by contracture of the calf muscle, tightness of the calf group. And remember that the calf muscle is what's necessary to contract for us to stand up on our toes. So if you have tightness of the calf group causing a downward fixed position of the foot, that's what we call equinus or equinus contracture. Can it be caused by your diabetes type 2? Absolutely. Absolutely, it can be caused by diabetes, not just because of nerve issues, but we see lack of function or loss of function or tightening of muscle and tendon groups throughout the body in diabetes. So if you're really having an issue with the Equinus, that's definitely something you need to work out with your primary physician, with your podiatrist, with your therapist, and work on getting those muscle groups and those tendons more flexible so that you can function more properly. Because particularly if the equinus gets fixed, that means you can't move it anymore. It creates more issues with the ball of the foot. Start getting calluses on the ball of the foot. Those calluses, if they go unchecked, can break down and become blisters, ulcers, what have you. It can lead to catastrophe. But great question. So you're very educated on it. So keep working on that. Like I said.
The next question is from Sarah Van Duck.
Mm-hmm.
I have an issue with my feet peeling. It
Mm-hmm.
starts with little red spots on them. I've had them. I've had the issue for over 5 years. Uh, what should I do?
Okay. Peeling skin that starts as little red spots. That could be some type of eczema or dermatitis. It could be uh, you could be allergic to something. Or it could be something more systemic. It could be a vitamin issue. It could be something related to another condition you may have. So, uh, in order to figure out what will work best for you, is to figure out what is causing it. Put these things together, talk with your physicians, your podiatrist, and narrow that down. Once it's known what's causing it, the best treatment for it uh, can be devised. You can go forward to get that dealt with. I've seen this type of thing occur from 100 different causes. So for me to give you a single answer right now is difficult without knowing all the issues associated with it. But you're definitely going to need an examination, and you want to do that as soon as possible. In the meanwhile, if there's itching associated with it, you could use something simple like a 1% hydrocortisone cream that you can get from the drugstore to deal with the itching, a lotion or a cream to deal with the peeling. But again, just by itself, that's not going to be enough. You definitely need to get an examination.
Um, the next question is from a Marilyn Pearson.
Hmm.
What is the best way to cut involuted toenails,
Okay.
especially severe ones?
All right. So, Marilyn Pearson, thank you for the question. The best way to cut involuted toenails, especially severe ones. Now, involuted toenails, we also call them ingrown toenails or incurvated nails. They can be very difficult, especially as the more that they pinch in, and we may call them pincher nails. Now, think of it this way. Let's say this, my two fingers represents the edge of a nail. Typically, they're in this position or this configuration, but an involuted nail may be more curved or pinched. And as it goes down, that pinched area of the nail goes into the skin. And that can cause pain. If there's breaks in the skin, it can cause infection. The best way to deal with them is number one, get them checked out by a podiatrist, get them dealt with. In the meanwhile, what you don't want to try to do is cut them out yourself at home. Because invariably, what happens is that a piece of nail is missed, it's underneath the skin that you don't see, and as the days and weeks go by, you end up with an infected ingrown toenail and a major problem. If we're talking about someone that also has diabetes, as this is the subject of the day, that can lead to a major disaster. So what you want to do is see a doctor as soon as possible. Figure out why your nails are involuted or incurvated. They sometimes can be caused by the bone pushing up underneath the nail. If this is the nail again, the underlying bone pushing up, we could call them what we call like a tent pole type of situation. That'll cause the nail over time to become more and more incurvated and difficult to deal with, and especially difficult to trim the nails at home. So definitely see the professional. Go to your podiatrist as soon as possible to see what's going on with that. Excuse me. To see what's going on with that and to see what you need to do to help that situation.
Very interesting question next from C. Elson.
Yeah, I'm looking at that.
Yeah,
What causes the stop of blood circulation to the lower extremities, and what's the intervention to catch it early? So, what causes the stop of blood circulation to the lower extremities is a buildup of plaque in the arteries. Okay, just like the buildup of plaque in the arteries around the heart that causes heart attacks, the buildup of plaque in the brain that causes strokes. It's the buildup of plaque in the arteries to the legs that causes a decrease of circulation to the feet. So what you want to do is get some some circulation tests done, all right, to see what the status is of the circulation of the feet. That's how you catch it early. Just an examination with fingers on the feet is not going to be enough. I use a small handheld Doppler. You may have seen me use in some previous videos of my diabetic patients. We find things from there, then we send them on for more advanced circulation testing in my office with my vascular team that comes once a week. If they find even more issues, and they send them on to further testing, such as angiogram or something like that, to determine where the blockage of the blood flow is, so it can be removed. Again, particularly with diabetes, particularly in old age, circulation or poor circulation of the feet is often what leads to amputation. So finding that out early, getting it tested, getting an examination, doing levels of testing if necessary to find out where a blockage may be is necessary. Just like if you're suddenly getting chronic chest pain, got to get that checked out to prevent a heart attack. If you're starting to see cold feet, numbness of the toes, color changes of the feet and toes, you used to have hair on your feet and toes. Now you no longer have hair on your feet and toes. These are all symptoms of poor circulation. So you need to get testing done soon, as testing at levels that's necessary, and then go from there to make sure that the circulation problems are being dealt with properly. I got to wet the whistle real quick.
When you finish, a missed question from Awesomeness More. Is it okay to drink diet soda? I love Coke Zero.
Mm-hmm.
My friends tell me it's just as bad as regular Coke.
Yeah. The issue of diabetes and diet drinks. Sure, there may not be as much sugar or any sugar in a diet drink, but remember when it comes to diet and diabetes, it's not just the sugar, but it's also carbs. Carbs convert to sugar in the human body, and the diabetic uh, having too high a level of carbohydrates in your system can be just as bad as drinking Kool-Aid every day. So I wouldn't recommend that you use diet drinks as a replacement for regular drinks just because you have diabetes. Again, work that out with your primary doctors. Get a consultation with a nutritionist that specializes in diabetes in particular, and you can go from there. But diet drinks are not a replacement for regular sodas just because you have diabetes. I would not recommend that.
Next question is from Tarish Garman. I have type 2 diabetes,
Mm-hmm.
and I was told that it was caused from chemotherapy. I've never heard of that happening. Have you?
Actually, I have. Diabetes can be caused from a number of reasons, whether it be uh, genetic, passed down through family lines, whether it be after pregnancy, whether it be after some type of disease with the pancreas, whether it be from obesity. There are a number of causes of diabetes, and chemo is one of them. Especially if you've had to have repeat treatments of chemo. So you had chemo, it did its job for a while, then it may have been recurrence of the cancer, you had to go back and do it again. It is possible that the chemo could have definitely injured the pancreas, causing your diabetes, unfortunately. So definitely work with your endocrinologist on that, since your endocrinologist is the person to determine whether the chemo is the direct cause of your diabetes. Uh, so far, it sounds like you're a cancer survivor, and I appreciate that from you. But be sure that your diabetes is under control, regardless of the cause, and go from there to see where things stand with the chemo. Hopefully, the chemo is completed and you're moving forward from that. and see where things stand with your diabetes, and see how your cancer treatments relate to how your diabetes will progress or not. Ann Miller, Dr. Jefferson, I have diabetes. I guess that's one, type 1. I'm afraid of having neuropathy. Now, and you sound like a lot of people that I know with diabetes. They're afraid of neuropathy, poor circulation, and things that can follow with it. But what I would suggest to you is to be less afraid and more proactive. Proactive means taking those steps to determine what's going on with you, identifying those symptoms you have, recognize what symptoms to look for, and take the appropriate steps if they do occur. Don't operate from a position of fear, but operate from a position of knowledge. And that knowledge includes knowing what your vascular status is, having those vascular tests of your feet and legs, like I mentioned before, and knowing what your nerve status is, seeing your podiatrist, having the nerves to your feet and legs checked out on a regular basis to see where you are, to see where you stand. If everything is great now and you don't have neuropathy, you're not showing signs of neuropathy, and your blood sugar is in good control, that's fantastic. But that doesn't mean, everything's hunky dory. You have to stay on top of these things all the time, year after year, having these tests done to make sure there are no changes. And if there are changes in subsequent years, working with your doctors, you'll be able to uh, address these issues and prevent the issues that we talked about with diabetes. It's 4 o'clock. I'm going to take another question or two. Who was that from, Zay?
Um, Question number two, you said
Mm-hmm.
it it was from I think it was from Deborah Wiss.
Mm-hmm.
Um, I'm 72. I have diabetes. This is not yet well controlled. My toenails, except for the big toe,
Mm-hmm.
are very thin and soft. The nails in my hand split and peel. And I'm also losing hair. Is this diabetes related?
Deborah Wiss, thank you for your question. I'm looking at it now. Thank you, Isaiah. Uh, Thin toenails, soft nails, nail splitting on the hands, and losing hair. Is it diabetes related? It very well could be, especially if your diabetes is not well controlled, as you say. One question I would have for you is how long has it not been well controlled? How long ago were you diagnosed with diabetes? Has it been out of control the entire time, or has it been in control and then spiraled, or something else is going on? So, number one thing to do for you, like I said at the beginning of this presentation, is to get that diabetes in control. Number one. The issues you mentioned also concerning the nails on your hands and on your feet, and the hair loss could be associated directly to diabetes due to issues with blood flow. Blood flow doesn't just affect the feet, but blood flow affects the entire body. Remember, diabetes is a leading cause or is a leading cause of blindness, and sometimes that blindness occurs as a result of decrease of blood flow to the eyes. Decrease of blood flow to the kidneys causes patients to go on dialysis. Uh, Decrease, of course, the blood flow to the feet and legs can lead to amputation. So, getting that diabetes in control is what I would recommend that you do right away. Work together with your primary doctor, with your endocrinologist, and get that situation taken care of. And then other things can be seen to see if your hair and skin issues are either related to your diabetes, or are there other issues such as vitamin deficiencies, thyroid issues, other things that may be contributing to your hair and skin problems. But like I say, get that blood sugar under control first and foremost. Nothing is more important than that. Okay. We've been going a little over an hour, so I'm going to take one more question. Awesomeness more. Let me see. Thanks for the question about insulin resistance. Awesomeness, but I'm going to see if I can get one from somebody I haven't hit yet. Carissa M., thank you for that information about diseases related to Agent Orange. I'm going to look into that a little bit more. Thank you very much. Okay. For one more about diabetes. Okay. Aliana, ready for? I missed your question. Ask it again for me. Sorry, I missed it. Send that question again for me. Okay.
What is a unicorn bump?
What is a unicorn bump? I'll have to look that up for you, Aliana. And okay, here we go. How do you support family or friends who have foot issues? Okay, I did that one. Yeah. I answered that question. So if you missed that answer before, Yana, check out the replay later today. All right. I'll say, all right, so I'll answer the question about insulin resistance. Insulin resistance is when the body is not processing or using insulin properly. That we see insulin resistance mostly in folks that have obesity. An increased level of fat in the body makes it harder for the body to use insulin. Fat is a resistor of insulin function. Now, if you know, insulin is a hormone that we need to help process sugar, so we can use it for energy. If there's not enough insulin or no insulin being produced, such as in type 1 diabetes, or if there's a resistance to insulins that we see in type 2 diabetes, that means that the insulin that we are producing is not being used effectively. That's what insulin resistance is. And so you end up with similar type of disease process that we see in our type 1 diabetics. So dealing with insulin resistance means controlling body weight, controlling blood sugar, watching our diet, exercise, and working with your physicians to decrease your insulin resistance and get you to a more steady state. Charcot foot, as it relates to diabetes, and can it be prevented? Charcot foot is a disease process of the foot and ankle where the bones and the joints in the foot and ankle begin to break down. Over time, a patient with neuropathy can get to a point where he or she may not feel pain much or may not feel any pain at all. So as they continue to go through their day and walk around, they tend to walk with a heavier gait, more of a stomping type of gait. It may not be noticed by that person early on because of their neuropathy, but over time, the joints begin to break down. And if they're obese, or more particularly if they're morbidly obese, that accelerates the process of the Charcot formation. So you can get joint breakdown, bone breakdown. The foot will begin to get deformities. Often we'll see rocker bottom, where the bottom of the foot begins starts to look like the bottom of a rocking chair, and you can get ulcerations on the bottom of the foot as a result of all these deformities. Uh, Charcot foot often needs to be dealt with either through special bracing, special shoes, or sometimes all the way to surgical reconstruction to make the foot in a more normal position or in normal function to prevent ulceration or to help cure ulcers that may already be there. Uh, Can it be prevented? That's if the neuropathy can be prevented. Can the neuropathy be dealt with so that the patient doesn't get to the point to where Charcot develops? There's no particular drug by itself that will deal with these issues, but again, things in combination that can be used to deal with the symptoms. Early detection of peripheral neuropathy is paramount to help prevent any type of issue with diabetes. Again, thank you all very much for chiming in. Thank you for all the questions. It's been very informative, hopefully for you and definitely for me. Thank you for the hugs, Janine. Janine's she's probably my number one fan in the UK. So I appreciate you, Janine, and everyone else out there that chimed in today and has been supporting the channel. Again, when it comes to diabetes and the feet, prevention is the best medicine. If you have diabetes, if you've recently been diagnosed with diabetes, one of the first things that should be on your calendar is to see a podiatrist. Get the circulation checked. See what your circulation status is. Get your nerves in your legs and feet checked. See if there's any deficits in the sensation of your feet. If you have deformities such as hammertoes, bunions, things like that, get it checked out so the proper shoes can be recommended for you. Don't do kitchen surgery at home. Don't trim your own nails. Don't try to shave corns and calluses. Leave all that good stuff up to your podiatrist. Wear the proper size, wear the proper fit, wear the proper shoe for the proper activity. Don't smoke. Quit smoking. If you do smoke, if you don't smoke, don't start. If you're a teenager that's recently been diagnosed with diabetes, one of the worst things that you can do for yourself as you go forward in dealing with this issue is to start smoking. That's going to compound any of the problems that you have. Again, this is Dr. Jefferson, DC Foot Doctor. Thank you for joining in. Continue to support the channel. Check out this live stream and the replay if you joined us after we started. Again, if I wasn't able to get to your questions, please leave those questions in the replay of this video, and I will answer them forthwith. Again, thank you. Dr. Jefferson, DC Foot Doctor. Take care of your feet.